Thank you for watching the video. This is YouTube Medical University. Learn by listening for 10 minutes a day. Everyone, please take a look at your own feet right now. I want you to take off your socks and take a good look. Is one of your feet unusually cold? Is there a difference in how your toenails grow on each foot? Can you feel a pulse when you touch the top of your foot? If any of these apply to you, it's possible that the blood vessels in your brain are starting to get clogged even at this very moment. It might sound exaggerated, but this is a medical fact. In Japan, every year, about 60,000 people lose their lives to ischemic stroke. Furthermore, there are over 1.8 million people nationwide who are currently receiving treatment for cerebrovascular diseases such as ischemic stroke and brain hemorrhage. Here's what I'd like to share with you today. Your feet can show warning signs of an ischemic stroke. Moreover, these signs come from 3 completely different roots. In the first part, I'll discuss how blocked blood vessels in your legs can threaten your brain and how your legs reflect the health of your entire circulatory system. In the second part, I'll explain what leg symptoms appear and discuss how a blood clot in your leg can travel through your heart to your brain, including the reasons why this happens. In the third part, I'll explain how to check your legs yourself and when you should go to the hospital. If you watch until the end, your perspective on your legs will change starting tonight. Now let's get started. Let me ask you a question right away. Where do you think arteriosclerosis occurs? The heart? The brain? Of course it happens there too. But there's a place where the signs are most likely to appear first. That's your legs. The reason is simple. The blood vessels in your legs are the farthest from your heart. On top of that, the blood flow has to return against gravity. In a way, the blood vessels in your legs are like soldiers on the front lines. In other words, when symptoms start to appear in your legs, the front lines, it means that your brain or heart may already be experiencing some kind of problem as well. Let me explain a bit more specifically. Arteriosclerosis is a condition where debris called plaque builds up inside your blood vessels. Old water pipes get rust and dirt stuck to the inside, right? The flow of water gets worse, and eventually, only a trickle comes out. Exactly the same thing happens in the blood vessels of your body, and this is the important part. Arteriosclerosis is a condition that affects your whole body. If the water pipes in your legs are rusting, then your heart and brain are also rusting. Let me show you some actual data. Arteriosclerosis in the legs, which is medically called peripheral arterial disease, has been studied in patients with this condition. It was found that about 30% of them also have heart disease, and about 10% have abnormalities in the blood vessels of the brain. In other words, 1 out of 3 people with damaged blood vessels in their legs also has heart problems, and 1 out of 10 also has issues in the brain. There are even more alarming numbers. The ABI test compares blood pressure in the legs and arms. Normally, leg blood pressure is equal to or slightly higher than arm blood pressure. However, when the blood vessels in the legs become clogged, this value decreases. In a large-scale study involving about 50,000 people published in JAMA, it was found that those with a low ABI, specifically 0, after tracking people with an ABI of 0.9 or lower for about 10 years, the risk of dying from heart or vascular disease was 4.2 times higher for men and 3.5 times higher for women compared to those with normal values, 4.2 times higher. With just a single test, you can see this much into the future. So for people who have arteriosclerosis in their legs or whose ABI test results have worsened, what kind of symptoms actually appear? Whether you know this or not makes a difference. Let's look at the 5 danger signs that appear in the legs. The first is a symptom called intermittent claudication. It sounds like a complicated name, but it's actually simple. When you're walking, your calves or thighs start to hurt, but if you rest for about 5 minutes, the pain goes away and you can walk again. This is called intermittent claudication. Many people just leave it alone, thinking it's because of age. But this is actually a clear sign that the blood vessels in your legs are clogged. Second, only one leg feels cold. Are you just dismissing it as poor circulation? People with poor circulation usually have both legs feeling cold. However, if only one leg is cold, that's proof there's a difference in blood flow between the 2 sides. Only one side's blood vessel is getting clogged, especially if, even when you're in bed, only one leg doesn't get warm. This is something you need to watch out for. Third, it's harder for hair to grow on your legs, or you notice changes in your toenails. If the hair on your toes or your shins has stopped growing, that's a sign to pay attention to. Or if your toenails have become unusually thick or break easily, it means that blood isn't reaching the ends of your feet properly, so the hair roots and nail cells aren't getting enough nutrients. Because of this, symptoms can actually appear in your nails and hair. Fourth, wounds on your feet are slow to heal. Even small blisters from shoes or minor cuts on your toes, which would normally heal in a week or two, don't heal even after several weeks. This is also evidence that your tissue's ability to repair itself is reduced due to poor blood circulation. In the worst case, the wound can become a deeper ulcer, and if bacteria enter from there, it can lead to a condition called gangrene, where the foot starts to rot. Fifth, the pulse on the top of your foot is weak, or you can't feel a pulse at all. This is something you can try checking tonight. Try gently pressing the middle of the top of your foot with the pads of 3 fingers like this. The key is to press gently. Do you feel a pulse or not? If it's hard to feel or you can't feel it on one side, it could mean that the blood vessels in your foot are getting clogged or narrowing. However, it's difficult to feel the pulse on the top of the foot, so just because you can't feel it doesn't necessarily mean there's a problem. It might simply be hard to detect, so please keep that in mind. Some of you might have felt a bit alarmed after hearing this. In fact, in my own clinic, there was a male patient in his 60s who recently told me that his calves hurt when he goes for a walk. He said he thought it was due to lack of exercise, but when we did an ABI test, the numbers were clearly low, and it turned out that the blood vessels in his legs were starting to get clogged. When we did a more detailed examination and checked the carotid artery in his neck, we found that it was nearly 50% narrowed due to plaque. It's frightening to imagine if we had just ignored it as a lack of exercise. Legs reflect the condition of blood vessels in the whole body. In other words, if your legs are in a failing state or showing symptoms, there's a possibility that your heart or brain may also be experiencing some kind of problem. Up to this point, this has been the most common connection between leg symptoms and ischemic stroke. In the second case, a more direct and alarming scenario occurs when a blood clot in the leg passes through a heart hole and reaches the brain. If you miss this SOS sign as well, the risk of cerebral infarction increases. Please make sure to listen carefully. From the perspective of YouTube Medical University, where you can listen and learn in just 10 minutes a day, this information will be useful starting tomorrow and knowing it can help prevent future illnesses. Please subscribe to the channel before you forget which channel it is. I would really appreciate it. I've prepared a PDF document summarizing today's lesson on a single A4 page. It covers the 5 warning signs for your feet and what you can start doing today. I've condensed the self-check methods into a single page. I'm giving it out for free. If interested, register on the official line in the description and enter the 2 hiragana characters for foot to get the materials. First, I explained how blood vessels in your feet and brain can deteriorate together, so symptoms in your feet mean your brain's vessels are also at risk. The second part is a more direct story. A blood clot that forms in your foot can travel all the way to your brain. The feet and the brain are the farthest apart in the body, and yet a blood clot in your foot can cause a stroke. There are 2 mechanisms behind this. First, the first mechanism is atrial fibrillation. Normally, the heart contracts in a regular rhythm, but with atrial fibrillation, the atria can't contract properly and instead quiver irregularly. This is a type of arrhythmia. When you have atrial fibrillation, blood flow in the atria becomes sluggish, making it easier for blood to clot. As a result, blood clots can form inside the heart. If a blood clot from the heart travels to the brain during a heartbeat, it can cause a stroke. The American Heart Association reports that atrial fibrillation is involved. The risk of stroke in people with atrial fibrillation is about 5 times higher, and about 1 in 4 strokes in people over 80 years old is caused by this atrial fibrillation. So what is the relationship between atrial fibrillation and the legs? Actually, with this atrial fibrillation, blood clots can travel not only to the brain, but also to the arteries in the legs. When a blood clot blocks a blood vessel in the leg, it's called acute limb ischemia. One day, suddenly, one leg becomes cold and turns a purplish color. You'll feel severe pain and won't be able to feel a pulse in that leg. This emergency requires calling an ambulance. If blood flow to the leg stops, gangrene can develop within hours as tissue begins to rot. A single condition called atrial fibrillation can cause both a stroke and a crisis in your leg at the same time. So conversely, when something suddenly happens to your leg, it could actually be a warning from your heart. And there's another strange mechanism that connects the brain and the leg. That's the pattern I mentioned at the beginning, where a blood clot from the leg travels to the brain. You may have heard the term patent foramen ovale. I think most people don't really know about it. So what is it? It's a condition where there's a small hole between the right atrium and the left atrium of the heart. Actually, every baby in their mother's womb has this hole. Since babies in the womb don't breathe with their lungs, their blood doesn't need to go to the lungs. The blood takes a shortcut through this hole. After birth, this hole naturally closes. However, surprisingly, in 1 out of 4 people, this hole doesn't completely close. Isn't that surprising? Among those listening, there are probably people who are living normal lives even though this hole in their heart is slightly open. Usually it doesn't cause any problems. But things change when a blood clot in the leg is involved. A blood clot that forms in the veins of the leg is called deep vein thrombosis. It's also known as economy class syndrome, and the clot that forms because of it. The blood clot in the leg travels through the bloodstream and first reaches the heart. Normally, when it reaches the heart, the blood clot travels through the bloodstream to the lungs, where it gets stuck and causes a condition called pulmonary embolism. That's what usually happens. Pulmonary embolism is also scary, but normally blood clots don't travel to the brain. However, if there is a hole in the heart, the clot can pass through the hole and travel to the brain. This is called a paradoxical embolism. Paradoxical means it's not normal. What is especially scary are strokes of unknown cause or latent cerebral infarctions. They're often called that, but the cause is unknown. In fact, among strokes, it's said that these kinds of hidden strokes exist. If you don't know about it, you won't notice it. That's why, in order to prevent this kind of condition in the first place, it's important to detect blood clots in the legs early and take action. That's where swelling in the legs becomes an important sign. Many people experience swollen legs in the evening, and in most cases, this isn't a problem. If only one leg is swollen and tight, or if one leg is clearly thicker than the other, it could indicate a blood clot blocking a blood vessel. We've talked about some scary things so far. Some of you might be worried, wondering if you're okay, but don't worry. At Sandwichman, we'll explain in detail how you can do a self-check on your legs starting today, and when you should go to the hospital. Accurate medical knowledge can turn that anxiety into action. Please stay with us a little longer. In the lesson so far, I've explained that the legs and the brain are connected by 3 different routes. Route 1, a systemic disease called arteriosclerosis. If your legs are in bad condition, your brain is too. Route 2, atrial fibrillation. Route 2, a blood clot formed in the heart can travel to both the legs and the brain. Route 3, a blood clot in the leg passes through a hole in the heart and travels to the brain. This is called a paradoxical embolism. There have been a lot of scary stories, but from here on it's a story of hope. I'm going to introduce 5 self-check items for your legs that you can start doing tonight. Please give yourself just 5 minutes after your bath to do this. Let's check the following 5 items. Check 1, color and temperature of your legs. Line up both legs and compare them. If only one side looks pale or reddish purple, or if only one side is clearly cold. This indicates a difference in blood flow between the left and right sides. Check 2. Pulse on the top of your foot. Lightly press with 3 fingers around the center of the top of your foot, where the extension lines of your big toe and second toe meet. Can you feel the pulse? Thump, thump, thump. Try comparing both feet. Check 3. Look at the hair and nails on your feet as well as your toes and shins. Have you noticed that hair that used to grow has disappeared? Are your nails getting thicker or discolored? Check 4. Difference in swelling between the left and right feet. Press both shins with the same amount of force for 10 seconds. If only one side is deeply indented, or if only one side is swollen and tight, this is something to watch out for. Check 5. Walking test. Please pay attention to this during your usual walk or shopping tomorrow. While walking, if your calves or thighs start to hurt as if they're being squeezed, but after resting for about 5 minutes you feel better and want to walk again. If you notice this pattern, there is a possibility of intermittent claudication. Now, let's talk about when you should go to the hospital, divided into 3 levels. Level 1, consult your primary care doctor next week. If one leg feels cold, you notice hair loss, or your nails have changed, these are not urgent symptoms. It's worth getting an ABI test, which compares the blood pressure in your legs to the blood pressure in your arms. Please consider seeing your primary care doctor, or if you don't have one, visit a nearby cardiology clinic. Level 2, symptoms that require a checkup within this week, leg pain when walking, or a wound on your leg that hasn't healed for weeks. These symptoms suggest that the blood vessels in your legs are already narrowed and the condition may be progressing. In this case as well, please consult your primary care doctor. Please consider seeing a cardiologist or a vascular surgeon. Level 3. Symptoms that require immediate medical attention, sudden coldness or color change in one leg. If you have severe pain, or if you experience symptoms such as sudden swelling in one leg along with tightness, numbness, or weakness in your leg. If you have difficulty moving your body or speaking, these symptoms could be warning signs of a stroke. Please see a doctor right away. While early stroke detection matters, prevention is even more crucial. So what matters most for stroke prevention? That is walking. The American Heart Association also highly recommends it.
小動脈疾患の
It's an effective method.
25の臨床試験をまとめた
In a highly reliable study called a meta-analysis, people who continued walking for more than 30 minutes 3 times a week were able to walk farther without pain. There are reports like this. Strengthening the blood vessels in your legs also helps protect the blood vessels in your brain. Why not take today's lesson as an opportunity to try increasing your walking time a little starting tomorrow? Now let's summarize today's lesson. 1. Leg blood vessels reflect the health of your entire circulatory system. Arteriosclerosis in leg arteries means your brain and heart vessels are at risk too. ABI test, 0. If your ABI is 0.9 or less, you may die from blood vessel diseases in your heart or brain. The risk is over 4 times higher. Also, 1 in 4 people have a pathway for leg blood clots to reach the brain. A paradoxical embolism passes through a hole in the heart, and atrial fibrillation can send blood clots to both the legs and the brain. 3. 5 self-check items you can start today. Foot color, pulse, hair, swelling, and walking test.
そしてレベル別の行動
What did you think? I'm sure your perspective on looking at your feet has changed, and that's the first step to protecting your brain. Please let us know in the comments. I'll try the self-check tonight. But next time, I want to try the ABI test, but your words might encourage someone else to take action. And if you found this video helpful, I'd be happy if you could give it a thumbs up. Also, I'd really appreciate it if you could subscribe to the channel before you forget which video it was. Well then, that's the end of today's lesson. Take care, and see you in the next video. As a general practitioner, I've learned from patients how not to age starting in your 70s. Ways of living. I want to live this way too. People have lived like this. These stories share lessons I've learned from many patients. Chatting with friends is more important than exercise, and when it comes to medicine, less is often better than more. These are things I've learned from my seniors in life. No matter how old you are, you can live healthily and happily. It's filled with all kinds of wisdom. Please be sure to check it out from the description below.